So one of the guidelines that we came up with was that social skills training in the form of group exercises over a timely program could actually be enhancing to cognitive and behavioral components in schizophrenic patients. And this is specifically related to conversational skill, processing speed, and verbal memory. What supported this was a study that was actually analyzing cognitive enhancement therapy. It was a randomized control trial with 121 participants that were all diagnosed with either schizophrenia or schizophrenic disorders. And basically, it was over the course of 2 years. And within this cognitive enhancement therapy, what we had specifically looked at were the results of the group therapy component of it. And so in this group therapy, there was a lot of social skills training utilized. They would practice initiating and maintaining conversation, pair exercises, addressing conflict within each other's relationships. And so the domains that were assessed in the group therapy was relevant to our overall question because processing speed and verbal memory was directly targeted, and it found to be relevant to conversational ability. And as I'll talk about in the findings, that conversational ability was improved throughout the course of the study. And so the study was a level 2 randomized control trial, and the overall purpose was to determine the effects of cognition enhancement therapy on cognition and behavior. And so we see from the study that there was a slight effect on behavioral components at 12 months, and then at 24 months, so 2 years at the end of the study, there was a significant effect on these behavioral components, specifically social cognition and social adjustment. And so all patients ended up showing an improvement from the baseline in all domains. This included behavioral components and also cognitive components within the time that they started and the time that they ended the study. And so one specific thing that was noted and pretty significant in how much patients showed improvement was processing speed, which was directly related to the patient's conversational ability and their social adjustment. So it was actually commented on by the person who conducted the study that in the span of the results, the patients did have this behavioral improvement, but also approaches like social skills training might be preferable for more severely intellectually compromised schizophrenic patients. And this comparison, I think, was within this study between the social skills training in CET and then social skills training in SST programs was pretty interesting. And so we kind of came to the conclusion that the significant exposure to social rehab is related to improvement in cognitive deficits and related social behaviors in patients with schizophrenia even as a part of a larger therapy known as CET.